the newly released Australian government report on the COVID response. The truth is finally starting to sneak out. And they found that we should have released the children and the younger people early from lockdown and locked up the old fogies instead. Sorry, how many of our viewers are over 65? Well, as I was saying, especially to the esteemed senior members of society who watch these videos, and we appreciate so much, how do I say this? Well, it seems that the COVID response would have been much fairer to the younger people if they'd not been locked away so long. The role of us older people is actually to protect the young, and this report more or less says that we got the balance wrong. We sacrificed the young to save the old. We locked them up and condemned many of them to lifelong problems from lack of socialisation, mental health issues. All those children locked up in small houses, watching screens for even longer than normal, and not learning how to talk to their friends. Now, the overwhelming reaction of us older people is naturally to protect the children at all costs. Well, all right, just about all children. I was just thinking of a particularly obnoxious brat. Now, I think there are many shortcomings with this report, and I'm going to go into that in a moment, but there are also plenty of nuggets of truth. I think now enough time has passed, and many of the actors who were involved at the time of the pandemic have now moved on, that we can now talk about the mistakes with less chance of people losing their jobs. People are also less frightened, and there's nothing like fear to make all of us a little more illogical. As mentioned, the most important point of the report seems to be that it highlights the terrible mistakes that were made locking up children, especially in Victoria, where they were locked up for up to 40 weeks. That's effectively a whole school year. Now, I did a video on Jay Bhattacharya, the Stanford University medical guy who risked his entire career to blow the whistle on this, and he was brutally attacked, especially by people in the health authorities. In the end, the risk of COVID to children was extremely small. So look at this graph. The deaths were overwhelmingly among the older people and the very old people. So these three bars represent the 70-year-old, 80-year-olds and the 90-year-olds. The children on this graph, well, the bars are essentially too small to see, but we locked them up. The number of under 18-year-olds that died was 32 for the whole pandemic. For the 20 to 29-year-olds, it was 44. And remember that some of those may well have died with COVID rather than of COVID, and they're highly likely to have very serious other health issues. The average age of death from COVID was well over 80. The average age of death anyway is about 83. So one of the comments from the report says, for example, state and territory governments introduced restrictions for settings ranging from schools to playgrounds, despite evidence of limited transmission risks. Similarly, policies on hospital visitation ignored the critical role of parents that parents play in caring for their children. And it went on to say that increased social isolation, stress, anxiety, uncertainty, loss of control, disruption to daily routines, and concerns for the well-being of family and loved ones created the conditions for either the onset of mental health or deterioration of existing conditions. School closures and remote learning also led to increased engagement with social media, triggering weight and body checking behaviours for some young people. And that brings us to vaccines. Another excellent observation in this report is that distrust in governments increased as the COVID response went on, and possibly that distrust was highly warranted, as more and more of the actions of government looked more and more ridiculous. For example, we were told that the vaccinations would stop transmission.
You're not going to get COVID if you have these vaccinations. You're not going to get COVID if you have these vaccinations.
And most people who got vaccinated also got COVID.
We vaccinated.
Now, in the early part of the vaccine rollout, I thought it was completely reasonable that that would perhaps be what we expected. But as time went on, it became more and more obvious that despite whatever benefits of the vaccination in preventing serious disease, it certainly wasn't preventing infection. And that was so obvious, and yet the government kept on pretending that this was true. So we ended up damaging the reputation of other vaccines. So according to this report, people lost confidence that the vaccination was all it was cracked up to be. And for example, this shows the drop-off in the vaccination rate, despite the government's insisting that it was essential for all of us to be multiply vaccinated after the first couple. So COVID is effectively over, but the damage to the reputation of vaccines persists, according to this report. People are starting to wonder about the efficacy of all vaccines. So the report stated, general vaccine hesitancy and scepticism has increased around the world since the pandemic, and the declines are most pronounced among at-risk cohorts who would benefit the most from vaccinations. We really don't want people to lose faith in, say, the polio vaccination, but that's actually what's happened. So as was reported in The Australian, our Federal Health Minister stated, trust is easily lost, it's hard to regain. This is going to be a long, hard process. Yep, I couldn't say that better than that. And the only way to get that trust is to start to be honest about what happened. And don't forget that people even now are being banned from work for not being vaccinated. So for example, in Victoria, where else, firefighters are still having trouble working. I mean, this is just plain pig-headedness on the part of authorities, and it damages their authority by acting so unscientifically and also so obviously like a bully. But you've got to say, it's great to see that these things are now being discussed, things which were effectively verboten just a small time ago. But this report is 800 pages long, and I wish it didn't waffle so much. But despite 800 pages, it's staggering just how much was missed. Now, one of the reasons the report is deficient is that the government banned the writers from commenting on actions taken unilaterally by state and territory governments. And as most of the measures were done by state and territories unilaterally, it kind of is a report missing the main point. Anyway, some of the things that should have been considered that weren't, or very, very poorly, are, for example, a comparison of Australia's performance with countries such as Sweden. Did Sweden get it right, despite locking down very, very lightly? Did the bans on going outside make any sense? Was playing golf really going to spread the disease? Should children be banned from playgrounds? Should we have fired police and teachers and firefighters? Was that pig-headed authoritarianism? The report has not got enough really hard data and graphs on things like excess deaths. That is the best measure of the effect of COVID in killing people and of vaccines in preventing them, and also on the effect on other diseases and factors that occurred due to the response. I'd also like to have seen some comment on whether the adverse reactions were all reported or were they grossly underreported, and whether the response should have been changed when the virus mutated to become far less virulent. Was it Omicron, which was the first of the less virulent versions? It doesn't matter. It was certainly a time when the virus was much less virulent than the original version that was invented in Wuhan. Sorry, I might have just been spreading misinformation there. Sorry, I meant to say the original version that emerged just by chance down the road from the Virology Institute that just so happened to be working on turbocharging coronaviruses. The one where the lead scientist who was doing the turbocharging suddenly disappeared. The one where the institute was partly funded by the Americans and was working with a whole bunch of Western scientists. That one. But anyway, did our response change fast enough as the virus became less virulent? Or were we allowed to be scared to death by the authorities even when the virus had essentially become way less dangerous than it was originally? But you've got to have a lot of sympathy for the people in charge during COVID. It would have been a very, very difficult balancing act between the people who are focusing on the possibility of a horrible, grisly death, choking from COVID, and those people who were saying, we've got to keep things open, we've got to keep education going. We can't get fixated on one risk while making a whole bunch of other risks much worse. Now that fear brought out a mean streak. It brought out, well, illogicality, as it often does. And that's why we need to do much better next time. And that's also why this analysis in this COVID response is so important. The report, although it's just skimming the surface, is part of how we're going to get to the truth, which seems to be finally emerging, at least at an official level.